Hi, my name is Kory Miller. I'm a nursing student at the CF ADN program. This is Nicole Smith. She's going to help me ventilate my patient with an ambu bag. It's going to provide 100% oxygen. We're going to do it prior to the procedure, and we're also going to do it between sectioning. I want to check my physician's orders because you do need a physician's orders to suction your patient. After I check my physician's orders, I'm going to enter the room and wash my hands. I'm going to provide privacy and introduce myself to the patient. I'm going to check his name and date of birth and have him confirm with me that that is his name and date of birth. I'm going to explain the procedure to the patient, and while I'm explaining the procedure, I'm also going to let him know that there's a distress signal. So if at any point he has trouble breathing or he needs to take a break, he can let me know by raising his left hand. I'm also going to place this drape over him so he doesn't get any secretions on him. And I'm going to wear my PPE, which is this gown. I'm not wearing, for the purpose of this video so you can understand me, a mask and a face shield. I'm going to place the O2 sat monitor on his hand so that I can monitor how much air he's getting to his lungs. I'm going to check the suctioning. The PSI is prescribed at 120, which this is correct, and the suction is working. I'm going to do a respiratory assessment and listen to his lungs. I'm going to monitor his respirations. I'm going to check under his gown. I would also listen, have him turn over if he can and listen behind his back. I'm going to let the patient know I'm going to remove this pillow so that I have better suctioning for his trach. Okay, now I'm ready. I'm going to set up my sterile field. This is the new bottle of sterile saline. I'm going to check the expiration date and add some saline to my cup. I'm going to hook up my suctioning catheter and use this as my dirty hand. I'm going to check to make sure my suction is working and lubricate it with some water. I'm going to have my assistant ventilate my patient, 3 to 5 breaths. Now I'm going to enter the cannula in without holding the suctioning until I meet resistance. When I meet resistance, I'm going to pull back and suction. Now I'm going to rinse my suctioning and wait 1 minute and let her ventilate him again for 3 to 5 minutes before I suction one more time. I'm checking his O2 sat. It went up a little bit, but he still needs to be suctioned one more time. It's been 1 minute. Again, I'm going to enter until I meet resistance. and then I'm going to suction as I'm pulling out. I would suction no longer than 15 seconds. I'm going to rinse this again and pull this off. Again, I'm going to check my patient's O2. He looks better. He's doing much better. I'm going to check his lungs one more time. And again, I would check his back as well. I'm going to make the patient comfortable. Lower his bed, make sure his call bell's in place. When I leave, after cleaning up my mess, I'm going to document how he tolerated the procedure and how much his O2 went back up.